Welcome to the Healthcare Payment and Revenue Integrity South speaker interview series, where I, Lydia Toth, the producer of this upcoming event, will have the pleasure of interviewing some of our esteemed speakers. I'm currently joined by Dr. Ahmad Kilani, the Medical Director at Cleveland Clinic, who will be joining the panel discussing the strengthening of payer and provider relationships at our event in February. Hi, Ahmad.
Hi, how are you doing, Lydia?
So, my first question to you would be to briefly describe what you're hoping to discuss within the panel that you'll be joining at our event.
First of all, thank you for this opportunity. It's a great opportunity to increase collaborations with our partners across the nation. We'll all work together for the same goal, which is taking care of our mutual patients. I think there will be a lot of opportunities here to have some discussions about things, not simply what's the tradition look like, just the payers-provider relationship with one is providing the service, the other one just like paying for the service. Definitely, there's more things that we work together. For example, we all talk nowadays about chronic disease management, and there's growth need to work together and take care of patients who they need more things to happen. I mean, more resources, which is we can share kind of discussions about each side may have certain resources that can, provide to the patient. But working together, that will strengthen those resources because we know what we can use. We don't end up duplicating or, doing things in redundancy. I think we become more efficient and effective how we're taking care of those chronic disease management patients. The other thing, it's 2023. Everyone is talking about IT and the artificial intelligence, which is growing very rapidly. This is an opportunity how we can just collaborate on taking advantage of technology so we make things much easier for both of us. And also electronic medical records opportunities and interoperability, which where everyone is talking about better access to electronic medical record. So that's will reduce some of the delays and some of the things which is kind of might slow down what we want to do. Post-acute admissions, that's another opportunity I can think of. As a lot of patients now, they may require some rehab time, and sometimes may have opportunity how we can expedite. First of all, kind of like have the patients be treated in the right place and the right time, and when they need some post-acute opportunities, just how we can do this very efficiently, very quickly, without any delays. At the same time, we kind of pay attention to how we are utilizing our resources. So it's an opportunity to increase efficiency while paying attention to keep the cost of healthcare down. And of course, there's opportunity to streamline some of the current processes, how we exchange information, how we do peer-to-peer and things like that, and can we avoid some of these kind of like ongoing denials by like what each side needs to make things kind of like smoother and better, because that's would reduce the administrative burden for both sides.
Well, yes, of course. So going on from that, what would you say is your personal biggest challenge when interacting with health plans?
So the main thing which I think we still have is the inconsistency among health plans, as each health plan may have their own requirement and sometimes different policies. And even inside the same plan, you might be talking to physician A, might establish some kind of like relationship, and then you may work with a new physician which never worked before, and then the discussion might be a little bit different. So I think having some kind of consistency across the board inside the same health plan and from health plan to health plan will be a great opportunity, create some more standardization moving forward.
I think that makes a lot of sense. So finally, my final question for you would be to share with me what you are most excited for at the event.
This is a great opportunity, again, to work with our partners, have a dialogue, have an open dialogue, very transparent. I think we can't avoid by not working collaboration nowadays. I mean, there's so many challenges in healthcare. COVID definitely highlighted a lot of them. And I think we need to work together just to focus on what our patients need, which is going to help us provide the best journey for our patients from the time just they need anywhere from preventive medicine to all the way when they get sick, how we can just kind of like have them get what they need without increasing any cost. At the same time, just kind of working together just by taking advantage of a lot of what we have nowadays. So there's so much, and I think that we can achieve together. And I think the opportunity of attending this conference and speaking to our colleagues would be so valuable.
Well, I really hope that that does come through at the event, and I am super excited to finally meet you in person at the event in Miami in February. Thank you very much, Ahmad.
Thank you so much. Looking forward for the meeting.